cornerstone of Africa's foreign policy for Africa has been developing solidarity and cooperation with African countries. Engagement between the continent and China grew as the viral infection continued to disrupt health systems. Indeed, many African countries have had to endure tough times during the COVID-19 pandemic. It is a period that so many countries become so vulnerable. But it is also a period that saw the China-Africa relationship become stable and more profound. China came to the aid of Africa once first cases were detected on the continent. From diagnostic commodities to therapeutics and vaccines, as well as other medical supplies. Dr. John Kiru, the head of medical laboratories at Kenya's Ministry of Health, says the impact of this collaboration will be felt for years to come.
Our diagnostic capacity from the classical diagnostics now to molecular diagnostics like real-time PCR has really improved. Some of the labs that are now doing real-time PCR for COVID-19 had not even done the standard PCR.
Hospitals like Yaoundé Central Hospital in Cameroon received ventilators, oxygenators and electrocardiographs to aid the fight against COVID-19. In Kenya, Chinese-funded and built Kenyatta University Teaching, Research and Referral Hospital, which has been Kenya's main COVID-19 isolation center, has continued to receive support from China to equip its intensive care unit.
This is the intensive care suite. As you can see, we have all the gadgets that the patient who requires intensive care will be able to be assisted with.
When COVID started, I think one of the biggest problems we had was lack of PPEs. We could not get gloves, we could not get masks. It became a big problem. Now in Africa, the only savior then became China.
The Chinese government has supported African countries in every stage of the pandemic. China is helping some African countries like Egypt and Algeria to manufacture COVID-19 vaccines. Medical experts say COVID-19 has been a wake-up call for the continent. Some countries like Kenya invested heavily in genomic sequencing as part of their response to the ever-changing virus.
Without our own genomic surveillance, we wouldn't be able to know when new variants are arising, where they are going, whether they are severe or they are even fast spreaders.
He argues that it's now up to Africa to build on the gains made, and China could be a key ally when it comes to enhancing healthcare while leaving the continent more prepared against future pandemics. Enock Sikolia, CGTN, Nairobi, Kenya.